There is a disease that, according to the American Diabetes Association, affects more than 30 million people in the United States. Given this high prevalence, you probably know or know of someone in the United States with diabetes. But did you know that there's multiple types? Many people hear about this epidemic in the US, but they don't know much more about it. I have had type 1 diabetes for almost 6 years, so I know what it's like to live with this disease every day. Today I will be discussing how someone gets diabetes, who gets diagnosed most often with the disease, and the treatment options for both type 1 and type 2 diabetes. Ultimately, you will understand the difference between type 1 and type 2 diabetes. Type 1 and type 2 diabetes get mixed up in my experience the most. Type 1 diabetes is an autoimmune disease. Mayo Clinic states that islet cells are often damaged in this process of getting type 1 diabetes. This becomes a problem because there's no insulin left in the pancreas in order to digest sugar. Insulin breaks down sugar and carbohydrates, and since people usually eat sugar and carbohydrates, their blood sugars tend to rise. And these elevated blood sugars tell doctors to test for certain things such as those islet cells counts. These tests may tell the doctors how much insulin to prescribe. Insulin plays a key role in both type 1 and type 2 diabetes. In type 1 diabetes, while there may be no insulin left in the body, type 2 diabetics mostly still have insulin to use, but it becomes hard to use in the cells. The cells often don't accept the insulin, according to Mayo Clinic. They become resistant to the insulin. This causes the body to not process sugars properly. Mayo Clinic also states that there is no specific cause for type 2 diabetes, but there is risk factors. Being overweight and having a family history of the disease increases your risk for type 2 diabetes. Many people I run into ask me if I have the good or the bad kind of diabetes. Neither is good, but demographics vary between both of the diseases. Type 1 diabetes is often associated with children because most of the time children do get diagnosed, but adults can get this disease as well. Latent autoimmune diabetes in adults, or LADA, according to Everyday Health, is often mistaken for type 2 diabetes in adults because there's no insulin being produced anymore. Doctors are not sure how this disease picks who to select for the autoimmune disease. The demographics go beyond just family history or being overweight for type 2 diabetes. Mayo Clinic says that excess fat in the stomach, being of African American, Asian, or Native American descent, increases your risk, as well as being over 45 years old. Although these risk factors are a bit contrasting, treatment can be similar for both types of diabetes. Type 1 diabetics always need insulin. It is a life-sustaining drug. This can be injected with a syringe or used in an insulin pump, like I have, through tubing. People with type 1 diabetes must check their blood sugars at least 3 times a day in order to stay healthy and make sure they have within range blood sugars all the time. Some diabetics elect to use a continuous glucose monitor, or a CGM. The NIH's Diabetes Division states that this is a small wire worn underneath the skin, and this transmits approximate blood sugars to a device incrementally. This can be very helpful in monitoring diabetes because it shows trends and overall blood sugars over time. Blood sugar levels are very important in both type 1 and type 2 diabetes. While type 2 diabetes management includes diet changes, staying active, and medication. These medications may help the cells accept insulin again. Insulin may also be needed in type 2 diabetics in order to level out blood sugars. These changes may help someone to have a more normal blood glucose over time. This states Mayo Clinic. Dr. Michelle McGee, the director of MedStar Diabetes Institute in Washington, told CNN that with dedication, some type 2 diabetics are able to reverse the condition early on. Both of these conditions are hard work, but both types can be manageable. Mayo Clinic states that the measurement for a report of how a diabetic is doing over time with their blood sugars is called an A1C test. This is a glycated hemoglobin test, and this measures how much sugar is attached to the hemoglobin in the blood. This is the overall blood sugar over 3 months, approximately. And most diabetics aim for an A1C of 7% or lower. There are many people in the United States dealing with diabetes, and type 1 makes up a very small portion in America. Type 1 makes up about 1.25 million cases in the United States, while type 2 includes 29.1 million cases in 2012, according to American Diabetes Association. According to Mayo Clinic on July 31st, 2014, there may be grave consequences for both types of diabetics if they don't take special care of themselves with their blood sugars. High blood sugars over a prolonged period of time may lead to serious physical health problems. This includes nerve damage to the feet, which may lead to neuropathy and then maybe infection. Retinal damage in the eyes and also kidney damage are risks when having high blood sugars over a long period of time. Management can be tricky for both type 1 and type 2 diabetes, but people may lead an active and fulfilling life still. The American Diabetes Association says that there is still a growing number of people in the United States with diabetes, so being informed is very important. Thank you all for listening to this information about these diseases. Hopefully now you may be more informed when running into someone with any type of diabetes and what they go through in their